The prostate is the culprit that makes you wake up multiple times at night to urinate, and it's also why your stream is weak and you have to strain to get started. This small gland sits just below the bladder and wraps around the first part of the urethra, much like a ring-shaped pastry hugging a drinking straw. Its job is to add fluid to semen. Because of where it sits, even a modest increase in size can squeeze the urethra and make urination difficult. After about age 35, hormones shift. Some of the testosterone inside the prostate is converted into dihydrotestosterone, and the balance between testosterone and estrogen changes with age. These quiet, gradual shifts make that pastry ring more prone to swelling over time. From here, two common stories unfold. The first is benign enlargement of the prostate. This is not cancer. It is an overgrowth of glandular and supportive tissue that steadily enlarges the prostate and presses on the urethra. Typical signs include a slow start, straining, a weak or stop and start stream, dribbling at the end, the feeling of incomplete emptying, and frequent trips to the bathroom at night. Many men put up with these issues out of embarrassment, which leads to poor sleep, daytime fatigue, and a lower quality of life. The good news is that there are many ways to manage it. A clinician might suggest lifestyle adjustments such as limiting large drinks close to bedtime, cutting back on bladder irritants like strong tea, coffee, and alcohol, making a habit of urinating before sleep, and staying relaxed instead of tensing during urination. When needed, medicines can relax the smooth muscle at the bladder neck and within the prostate to improve flow, or block the enzyme that converts testosterone into dihydrotestosterone so the prostate gradually becomes smaller. If symptoms are severe or medicines are not enough, modern procedures performed through the urethra can widen the passage and relieve the pressure. The second story is prostate cancer. This usually begins in the outer part of the gland, where some cells start dividing without control and form a tumor. Early on, there may be no clear symptoms, or the signs may look exactly like ordinary urinary trouble, which makes the condition easy to miss. That is why, in addition to listening to your body, men from around age 50 onward, earlier, if a close relative has had prostate cancer, should speak with a clinician about a physical examination performed through the rectum and a blood test that measures the prostate-specific antigen. Finding problems early opens the door to less invasive and more effective choices. Depending on the stage, treatment may include surgical removal of the entire prostate, radiation therapy, therapies that lower or block the effect of male hormones to slow tumor growth, or combinations of these approaches. The most important message is not to write urinary problems off as just getting older. If you are noticing the signs described above, make an appointment and get checked. With a clear diagnosis and timely care, you can regain uninterrupted sleep, a steady stream, and the confidence that comes with feeling in control of your daily life. If this clarified that night pee is not equal to always cancer, hit like, subscribe plus bell on episode 2 breaks down how to lower BPH risk, habits, nutrition, circadian timing. Questions? Comment BPH.